Hi, my name is Tracy. If this is your first time seeing me, welcome to Medicare Minutia, where you'll get information to help you with the complicated and dry subject of Medicare and all of its parts. In this video, I'll address the 2023 changes in Medicare's annual enrollment period, which is AEP, which is coming up here October 15th through December 7th. During that time, it allows existing members of Medicare to make changes to your secondary coverage or your supplemental coverage. So before I talk about the changes, though, I have to get a disclaimer out, which is, the pesky government rules. Neither I nor my business is employed by, contracted, or affiliated with any government agency. I am an independent contractor, broker with private insurance carriers. I do not offer every plan available in your area. So please contact Medicare.gov or 1-800-Medicare to get information on all of your options. So let's get to it. First, there were changes to Part B. As a reminder, Part B is the foundation to your Medicare coverage. This is the portion that covers your physician and outpatient benefits. This is what you pay to Social Security and is necessary for you to have secondary coverage like your Medicare Supplement and Medicare Advantage plans. We don't know yet what the 2023 costs of basic Medicare will be. However, it's expected Part B premium will either stay the same or possibly decrease. Centers for Medicare and Medicaid Services, which is CMS, typically releases those numbers in mid-November. For some background on the current cost in 2023, some people like to know these things. The premium had the biggest increase in the history of Medicare. It increased 14.5%, or specifically $21.60 to $170.10 per month. Some pay more on that premium based on your income. So why did that happen? Some medications that are administered in a provider's office get billed under Part B. CMS stated it was largely driven by statutory requirements to prepare for potential expenses such as trends driven by COVID and anticipation of the cost of a Biogen drug called Aduhelm, which is used to treat Alzheimer's. The cost of that drug was expected to be $56,000 per person. It has proven not to be as effective as anticipated. Thus, several prescribers, including your Cleveland Clinic, have not been prescribing it. As a result, Biogen dropped the cost to $26,200. The Health and Human Services, or HHS, Secretary Becerra instructed CMS to reassess the Part B premium in response to the reduction of the cost of the drug. So on May 27th this year, CMS announced that any savings as a result of that price reduction would be reflected in the year 2023 Part B premium. So let's hope that either the Part B premium stays the same or best case scenario, it drops. Now for Medicare Advantage members, so those are your HMO or PPO plans typically, or some other areas of the country have cost plans, private fee for service plans, and PACE plans. So please note though, Medicare Advantage plans do vary county to county, and benefits will be different based on where you live. Not all benefits will be offered in all areas. However, the good news is most all of the carriers have come out with improvements in benefits for next year. So for example, many of the carriers have expanded into more counties. They've reduced the maximum out-of-pocket limits. So what that means is if you do have copays on your plan, there's a threshold that you reach. Let's just say it's $3,900. If you reach that, then the insurance company picks up 100% after that. That's what a maximum out-of-pocket limit is. You'll see an increase in dental, hearing, and vision benefits. You'll be provided with what's called a flex card. That's going to allow you to shop for over-the-counter products in a retail store versus buying products through a catalog. The cards will be loaded with funds and will function very similar to your bank debit card. In some cases, the funds can also be used to pay for groceries, rent, utilities, and more. Cards will begin shipping to members in mid to late November, but they'll arrive by January 1. So one carrier expanded their gym network to include lifetime fitness centers, and other benefits included in some plans, not all, are your end of life planning documents like do not resuscitate or a DNR, power of attorney or a POA, or your living will. Some will even include caregiver benefits like a robot dog, believe it or not, and more. And if you're a veteran, please reach out to me because there are several attractive plan options out there with various carriers where a lot of them are giving you Part B give back or Part B credit. These plans are designed for when you're also getting benefits from the VA. They just enhance your choice of doctors and include the extra benefits that I already mentioned. So important for the Aetna HMO members, depending on where you live, your plan may be changing. Please reach out to your existing agent for help with getting that changed, or if you call Aetna directly and have them facilitate the change, then they will keep your existing agent as the agent of record. Now, on to the Part D portion, which is your medication. CMS creates the framework. I like to use the analogy of building a house. So in other words, that framework for all Medicare Part D prescription drug benefits. So you'll see numbers for 2023 on your screen now. Keep in mind, your plan may be different, but these are the maximums that each carrier follows when designing their plans. Some plans may have lower or no deductibles, and some plans will cover more medications through the gap and will put more drugs on tiers 1 and 2. Tier 1 is your preferred generics, tier 2 are your non-preferred generics, respectively. Also, I want to give you a heads up on the future of Part D. This year, the Inflation Reduction Act passed, which created some changes for 2023 and beyond. On the screen, you can see a timeline for some of those changes. In the description, you'll see a link if you want to read more about that. But what will be implemented in 2023 is drug companies will be required to pay rebates if drug prices rise faster than inflation. The 2020 Trump executive order will continue to limit the cost of insulin to $35 copay under Part D. The cost of adult vaccines will be improved under Medicare Part D and Medicaid or CHIP. Then in 2024, the 5% coinsurance under the catastrophic stage of your Part D coverage will go away. And then also in 2024, the low income subsidy, also known as LIS, full benefits will go up to 150% of federal poverty level. Starting in 2024, Part D premium growth will be limited to no more than 6% per year. So please be sure to review your annual notice of change. We also call it the ANOC. That should be arriving in your mail any day now. That will provide you with specific information about the plan you currently have. And then, of course, if you see anything you don't like, reach out to the agent you have and ask them for help with changing it. Or if you have the mymedicare.gov account, which I recommend you do have, you can search plans there, and it will keep track of every medication that you filled during the year, so it'll make it easier for you to search for your plans. But make sure to reach out to me, my existing members or my existing clients. Reach out to me for an appointment if you need help making changes. Click the link in the description for my email, and my calendar is listed there also. I wanted to remind you to always be aware of bait and switch tactics. The past open enrollment, you saw many TV commercials that offered to pay 100% of your Part B premium payments, which is not possible unless you're on state Medicaid. In California, they call it Medi-Cal. But these third-party marketing organizations have used that to get you to call them. And then when you call, they collect your information, and a lot of times they've switched the plans. Some people didn't even know that they had switched their plans. CMS has put in measures to help stop that, but always be aware of someone calling you or an ad that is sounding too good to be true. I also wanted to quickly mention Medigap or Medicare Supplement changes. For those located in Nevada, the birthday rule legislation was passed and went into effect in January 2022. The rule allows existing Medicare Supplement members to make a plan change during the month of their birthday and the month following without answering any health questions. This is huge for those of you who have seen premiums increase over the past years. I've been able to save my clients quite a bit of money, in some cases cut their cost in half by changing their plan. And a key point to remember here is these plans are regulated by the state and Medicare. So no matter which carrier you choose for coverage, you will be provided the exact same benefit coverage. So example, if you have a plan F or G with say AARP or United Healthcare and you move it to say Aetna or any other company, you will have the exact same benefit coverage and your access to providers will be the same no matter which insurance company provides your coverage. Some of the differences between the companies are how rate increases are done, their value-added benefits, and household or electronic draft discounts. But please reach out to me prior to the month of your birthday if you're interested in making a change. And to my existing clients, I want to sincerely thank you for your ongoing trust in me. This is my 18th year specializing in Medicare. Wow, I can hardly believe it. Time has really flown by, but please know how grateful I am for the relationship I've built with all of you over the years. It is my sincere pleasure to help and guide you through this crazy maze of, let's face it, very dry information. Please don't keep me a secret. Referrals are my best compliment. Please be sure to share this and hit the like button and be sure to subscribe so you can catch more information in videos to come. And now go out and have some fun.